Hi everyone, Dr. Connie here. After living with lupus for over 19 years, I finally have some perspective. What doctors don't tell you about lupus is that they really don't know what the cause is or how you would respond to the medication and the treatments. It's a big mystery to them. I used to be that patient who would sit at the doctor's office with blood pressure elevated because I didn't know what to expect at that very visit. And this is from someone who's more versed than your average lupus patient, as I had a doctoral degree in physical therapy when diagnosed with this confusing disease. I met my first rheumatologist at Loma Linda University, and I have to say his bedside manner was second to none, although my current rheumatologist comes close. My visits got easier over time when my symptoms were finally under control over a period of about 2 years. I began to ask questions though about the medications, and my curiosity sparked in finding a solution to this problem that I had. I became anxious about getting off the toxic meds ASAP, and over time we were able to decrease the dosage. This was a true fight for me with my roomie every visit to get off the meds, as he was weary of taking me off the prednisone and the other medications that I was on. This is where we as patients need to become educated and empowered, and when our symptoms are under control, it's up to us to start rebuilding our health. So, some truths about lupus. So, doctors don't know what the outcome will be for you. That's the truth with lupus. Yet, so many of us place our confidence in our doctors to cure us or keep our lupus under control. And my current rheumatologist is a renowned physician with the best bedside manner ever known in medicine, in my opinion. And she's compassionate, caring, and hardworking. But she only has so much time for me and my lupus because she's traveling all over the world for various symposiums, medical conventions in rheumatology, and sits on the board of many nonprofits supporting them all. I honestly don't know how she does it, but I'm truly thankful for her as she strives to be on the cutting edge of this autoimmune epidemic. I do understand that these meetings and conventions will help with the new research for finding treatments to address specific differentiated autoimmune conditions. And I do know that while these clinical trials are the first step in getting the cure, it's not the ultimate solution for the future. The solution should be in prevention, in my humble opinion. With the invention of antibiotics, we've been able to save many lives, but we're now having issues with tough strains that are no longer responsive to the antibiotics, and this is becoming a huge issue. And us as lupis have to rely on various antibiotics, sometimes regularly, as we're susceptible to many infections. This is just an example to support my stance. I've come to realize that we're creating a perpetual cycle of disease, and as a lupus patient, as well as a healthcare provider, the more logical option is to understand the cause to prevent autoimmunity altogether. There are clear solutions to the problem, yet the medical system is looking in the wrong direction, and often us lupus patients are passively waiting for the cure. Lupus awareness is important. But what's more important to me is knowing how to heal lupus. So a little bit about the medical system. We relocated from Loma Linda, California to the suburbs of Georgia in 2003, and I was in the market for a rheumatologist. And having come from a renowned research hospital, Loma Linda Medical Center, where I attended school and was overseen by my favorite roomie, I wanted nothing but the best. I looked to Emory Medical Center and met the best doctor there, or so I was told. Long story short, after 4 months of waiting, I was finally able to get an appointment to see the rheumatologist, and I was thoroughly disappointed because I felt as if I was talking to the wall. First, I sensed that he couldn't care less about my lupus or me as a patient, and it was clear to me that the interest was lacking. So I never went back. Teaching hospitals like Emory attract lots of physicians and residents and foreign-trained physicians, and many serve time there to get to the next level in their professional career. I've had many physician friends and I understand their struggles intimately. Many of them have lost their passion for the work because of the bureaucracy in the current healthcare system. So the pivoting moment. When my lupus became life-threatening in 2004, I sought out Lupus Foundation of America. I was in Georgia, so I met with the founder of the Georgia chapter at the time. And to be honest, their focus was more on lupus awareness, promoting lupus awareness walks, and fundraising. I honestly didn't feel any genuine interest for lupus patients from the chapter leader. I felt the foundation was more about raising funds. I didn't know how all those efforts could help in the long run, but I kept in the loop and attended symposiums and patient support groups. I was desperate for some answers. And when I attended the symposium here in Georgia, there was a forum discussion with a row of physicians up at the top, sitting at the front of in front of the hundreds of patients, lupus patients, asking questions mainly on medications and the plans for future research. Then I supported the local Georgia chapter in attending the gala here locally in 2009. And again, I felt the focus was clearly not where I wanted it to be. Don't get me wrong, they are all very important. But I know all too well focusing on the problem is not the answer. Medications can be a short-term solution, but for long-term health and prevention, we must be proactively creating health. This takes discipline, persistence, commitment, and most importantly, it takes action. I've also seen few lupus blogs, and they seem to be more about spreading lupus awareness. So I decided that I would devote my blog site to be more about the day-to-day solutions to our deep problems. I called the site Lupus Rebel because we must start to push the boundaries a bit to radically change the current state to the one that is more conducive to healing and providing hope for us lupis. We've got solutions that have worked wonders for me personally, as well as the patients that I treat at my center. You can begin taking action today by downloading the Lupus Diet Guide in my blog, and the link will be located in the comments below. Visit our Lupus Rebel supplement store to support your health, as well as get to the root cause of lupus, as lupus begins in the gut. And thanks for watching. I'd love to hear from you. Please leave me feedback, share this video, follow me, and subscribe to my YouTube channel. I'll see you next time.